Hello, this is your Louisiana chiropractor, Dr. Eric Prather, coming to you from Lafayette, Louisiana at Prather Chiropractic Services. Today we have in with us our good friend Victor Gonzalez from
Gonzalez, Louisiana.
That's right. He presents today for his 5th adjustment, and I wanted to do a video on him because he had a really interesting case in which Victor was in a really bad accident 15 years ago.
Yeah, 2005 and
Head-on collision.
Correct.
Right. Where basically the left side of his body suffered a crushing impact injury up from the bottom to the left side. He broke his left tibia. His hip socket was driven through his hip bone. The head of his femur was driven through his hip socket. He had a broken jaw. So basically left side was all banged up.
all banged up.
Yeah.
Plate thing. Yeah, plate on the wrist.
Left arm broken. So broken leg, broken hip, broken arm, broken jaw. And Victor has dealt with pain from that injury for 15 years. He had some orthopedic surgery done in the beginning, obviously an emergency situation, but experiencing all of this different pain going down the leg, lower back pain radiating up his back, on and off through the years. He managed with weight, tried to manage it with weight loss, pain medicine, anti-inflammatories, etc. So it got to where he's like, look, I can't deal with this anymore. I've got to do something else. Now, Victor's wife is a pharmacist. They did some research online and they came across some information on Gonzalez Chiropractic.
Correct.
And then my name showed up because we do Gonzalez Chiropractic here, and I've been doing this for 20 years. So he's like, hey, let's give this a try. So Victor came in about a month ago, all right? We started we did a good thorough exam. Was that exam and evaluation thorough?
It was actually the most excellent one I've had, actually. It was awesome.
Well, I appreciate that. The Gonzalez work allowed us to, having a background in the Gonzalez work allowed us to evaluate his pelvis, determine where his problem was coming from, disruption in his SI joints bilaterally. And you can see from the accident, the surgical screws that were done to put his acetabulum back together. The acetabulum is the socket that the femur head fits into. So you got that cup and then you got the femur head. And the surgeon did a really excellent job of piecing that together. That's incredibly difficult to do. You're dealing with a comminuted fracture, means multiple pieces, and he was able to put you back in good working order. But what ends up happening is the sacroiliac joints get left untreated. And we can do some analysis with the Gonzalez work and evaluate the position of the pelvis and how it's aligned and how it's not aligned. So we looked to that, and we did our analysis. We started the adjustments, and you've had 4 adjustments.
Correct.
Your chief complaint was low back pain.
Lower back pain.
Shooting up the back. Okay. 4 adjustments. What percent improvement?
90% actually. It's been really amazing. I mean,
90%.
Yep.
4 adjustments. And that's the testament to the power of what chiropractic can do when it's done correctly. Chiropractic's done very differently from office to office. You have to do your due diligence, research your doctor, research the different techniques that they're saying that they do, study them. If we can learn them, the public can learn them too, and learn more about them. And it's got to coincide. You know, chiropractic is a specific thing. There's a lot of physical therapy that gets done and other modalities that gets done in a chiropractic office that gets thought of as being chiropractic care. Well, it's not chiropractic care, it's physical therapy, and it has its place, and it can help patients in many different ways. But chiropractic specifically, the whole practice has been based upon doing adjustments, correcting orthopedics of joints for the purpose of restoring nerve function to the body. And there's a lot of new neuroscience that explains what's going on, but it gets complicated. I mean, you can't get into that with every patient, but the purpose of the adjustment is restore movement to a joint that's moving wrong. It gets underdiagnosed, and then unfortunately it gets mismanaged as a result. That's where we come in. So do y'all's research, please. Research a chiropractor, research the techniques that's being done, making sure that you're getting real chiropractic when you come to the office. But I'm delighted for you.
That's it. Like I said, told you that's what my wife did. She did the research and all that. She's really like I said, being a pharmacist. She knows
Right,
the medical
healthcare
background,
professional, right?
Kind of knows which way to go, and she just really researched for about a month to figure out what's the best way to go. And it brought us to you. And that's why I came down here.
That's awesome, Victor. And I'm glad you'd be willing to make the drive all the way out here. I know that's not a hop, skip, and a jump. Hour and a half to come to a doctor's appointment. It's not that's not an easy trip, you know,
No.
crossing the Basin Bridge, and you know, you're driving that long, you get out, your hip's hurting, but today the hip's not hurting.
It's not hurting.
Yeah.
I actually got out of
It's
it
not
to hop
hurting.
along versus having to just
Right.
limp along. So
Now, you know, x-raying our patients is important to be able to see that, because there's adjustments that we do to the hip socket, but because he's got screws and plates holding that acetabulum together, we leave the hip alone, but we are still able to work on the sacroiliac joint. This is the sacrum. This big wing bone here is the ilium. Where they come together, that makes the sacroiliac joint. This is what it looks like on the model. So we've been able to correct the movement here, and the pain that was radiating up his back and down his leg has gotten better. It's not true sciatica, it was sacroiliitis, sacroiliac dysfunction. So you just gotta know. You gotta know how to evaluate it, and you gotta know how to adjust it. But I'm glad you're doing great, man. I'm glad you're doing better.
appreciate it.
All right. So let's get, we're gonna start with your decompression today, and then we'll finish up with our normal routine.
All right.
All right, buddy. There we go. Victor Gonzalez from Gonzalez.
Yeah, well, the
I want a
first time,
town named after me, man.
right? First time you get to help me up here.
That's right. So that's right. That's true, huh? Keep those legs relaxed. How was traffic coming in?
It wasn't bad at all.
They had a lot of boats in the basin. Use the rows. There's usually a lot of fishermen out there, man.
You know, there's only a few today. There's only a few.
Right.
So
We were in Toledo Bend over the weekend, and I got blown all over that lake.
oh, I believe it.
We didn't get any fishing done.
Let the boat rain this weekend.
Right. Okay, tight squeeze. All right, very good. All right, Vic. Back teeth touching. Don't bite your tongue.
Nope.
Breathe through that nose. And wiggle your third ear. Great. Good movement. Good movement. How far did you cut that one?
That went all the way down.
All the way. But they get easier, you see?
They do. They do.
Yeah, I mean, less compressive stress in there and less scar tissue to break loose. And I could feel that adjustment. That's it. Went easier and easier as it goes. So that's good news for you. All right. Come up on. There we go. We'll spin around. All right, let's come jump over to the biophysics table. We'll go face down right here. All right, tilt that head up for me a little bit. There you go. Okay, feel that piece kick up. Now we're working on Victor's sacrum right here. Putting movement in the sacroiliac joints, in the lumbosacral junction. Good. 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 All right. Cervicals, Vic. That's good. Stay there. Okay, roll it over, my man. Okay, hands on the tummy. Adjust the head back over the shoulders. Okay, arms outstretched. Good, full body tune-up.
Sure.
Okay, hands on the tummy. There we go. Now the right leg is safe to pull, even though we don't pull the left leg because he's got screws in that hip socket. So it's good to know that before you start doing treatment on people. You want to
Correct.
do proper exam, proper history, proper imaging, all of that. All right. There we go. Good release. Good release there. Y'all both bionic.
Yeah.
Someone's got a, you still got that rod, or you had it taken out?
Mine taken out.
Yeah.
I'm hollowed in my bone.
Yeah. That rod in her
I thought
forearm
about
too.
doing, like, tell you, they told me that's an option, but it was like 50-50, it wouldn't even work with the pain, so I was like, no, it's all right. Well, I go through the
Yeah,
surgery.
you leave that cavity in there.
Correct.
Mine
there's
was
no-
coming out. That's why I had to have mine removed.
Yeah, if there's no stress fractures forming around the rod, no threat of infection, you know, sometimes it's best to leave that sucker in there versus dealing with all the aftermath of the adjustment. All right, Vic, have a seat right there. I'm gonna clear out that upper cervical.
Tell my wife even tells me she knows the difference in my posture too.
Exactly. You're getting taller.
Yeah.
Okay, we're gonna adjust this atlas from the right here. Chin up, that's it. Let that right ear fall. That was it. Make sure your head's screwed on right. Did she tell
Yeah.
you that too?
Exactly.
Your head's screwed on wrong. All right, man. I'm done with you. Any questions for me?
No, it was great.
Soreness, manage it with ice. Stretching, you know, you probably be able to move your adjustments soon to as needed. Since we've gotten that 90% corrections, I like to do with patients in the beginning is adjust you close together, try to get that 75, 80% improvement is the original goal for the first phase. And then after that, come as you need it.
Even Ellie, he said 6.
Right.
He told me 6 and then as I needed.
That's true.
So I'm on 5
Sure.
today. Today was the 5th one. So I mean, that's
That's pretty good.
got one more.
We're right on track.
Exactly.
All right. Well, guys, if y'all like this material, please like, subscribe, share to the channel, hit the bell for notifications. Talk to your family and friends. If you come across something you think that we could help, if you come across someone that could benefit from this information, please turn their attention to it, because we're trying to help as many people as we can get chiropractic care. It's safe, it's natural, get them off some medications, get them out of some pain, and that's what we're here to do. Vic, got anything?
Yeah, you can take it from me. It's worth the drive. I mean, I was actually like really skeptical about chiropractic and everything, but we did a research and found Dr. Eric here, and it was just like it's been amazing. It's been awesome for the 5th time, and I can't say anything but great things about it.
I appreciate that, man.
Thank you.
Thank you, Victor. All right. This is your Louisiana chiropractor, Dr. Eric Prather. We'll see you soon.